How poverty impacts mental health, the psychological impacts of economic hardship. Poverty is typically defined as a lack of access to normal or sustainable monetary funds and material possessions. This often leads to people living paycheck to paycheck, trapped in a never ending cycle of fear, always unsure if they will be able to afford rent or even their next meal. Poverty doesn't only impact socioeconomic status, though, it can also have notable influences on health, including mental health. Poverty is a common cause of chronic stress. Financial insecurity can lead to immense anxiety as individuals feel as though they're being deprived of human needs that are necessary for survival. This tension can also have physical impacts, increasing stress hormones, which can be damaging to the entire body. Mental illness rates are also significantly higher in poor communities, especially regarding anxiety and depression. People living in poverty often lack access to proper and healthy coping skills, which can lead to them turning towards more harmful mechanisms such as substance abuse. Additionally, those in poverty are often isolated and ostracized from society, which can contribute significantly to depression rates. Environmental factors also play a role in chronic stress, as unsafe neighborhoods, food insecurity, and unstable housing can all lead to fear regarding the health and safety of both the individual as well as their loved ones. The impacts of poverty are not isolated to just the working adults in the family. They can also have massive and even sometimes permanent effects on the children as well. Even if they're not actively involved, most children will still feel the immense stress of their parents, which can contribute to their own anxieties. Additionally, many children in poor communities are forced to start working at a young age in order to help support their family. This can increase their burdens and give them less time to focus on academia. Even if these children are able to grow out of poverty in their adulthood, many of them will still struggle with the psychological and neurological impacts long term. There are also significant barriers to psychological care for poorer communities. For an example, a lack of universal health care and health insurance has led to many families being unable to afford proper psychological treatment. Without insurance covering the cost, finding psychologists and psychiatrists can be extremely unfeasible, especially for these poor families. And it can also make it very difficult to receive proper psychiatric medication. This delay, or at times complete lack, of care can lead to the significant worsening of mental health issues that are already more common in poor communities. Some potential solutions to help the mental health of people living in economic hardship include introducing universal psychological care that is available to everyone, no matter their socioeconomic status. Additionally, we can increase education regarding mental health awareness, especially in poor neighborhoods and schools, which will ensure that all individuals learn proper and healthy coping skills and treatment methods. Finally, using tools such as community initiatives and fundraisers can help to not only spread awareness on the link between poverty and mental illness, but can also raise money to help alleviate the mental struggles of these communities.